I'm washing my hands. I'm going to shut the door to provide privacy. I'm Colleen. I'm going to be your student nurse today. I'm going to be performing a head-to-toe assessment. Can I please get your name and your date of birth?
Hannah Harden, we're 1995.
All right, perfect. I'm going to ask you a couple questions before I start the assessment. Do you have any allergies?
No.
Are you experiencing any pain today?
Mm-mm.
Do you know why you're here?
Checkup,
All right, and do you know what today's date is?
4/30/2020.
All right, and do you know where you are?
Norfolk Gen.
All right, so upon general survey, the patient is alert and oriented ×4. She is awake. She appears her age. Her hygiene is good. She moves with ease and oh, and she is happy and compliant. She appears to be happy and compliant. Now I am going to start with your head assessment. Before I start, I'm going to ask you a couple questions. Have you had any changes in your hearing and your vision?
No.
Have you been experiencing any headaches? Any pain?
No.
All right. Have you had any stuffy noses or nasal occlusion?
No.
Any drainage from your eyes, ears, or mouth?
No.
No? All right. So I'm going to start by palpating your head to check for any masses or any bumps or depressions.
Mm-hmm.
So I'm going to do that now. All right. There are no bumps or depressions noted. Your hair is evenly distributed and the shape of your head is round. I'm now going to assess your eyes. I noticed that you have 2 eyebrows and 2 eyes. Hair on your eyebrows is evenly distributed. I'm going to look at your sclera and your conjunctiva now. I'm just going to shine a light in them. All right, and the sclera are white. Do you mind pulling down? All right, and the conjunctiva are pink and moist. I'm now going to look at your pupils now. I'm going to look for it. I'm going to assess the size first. I see that they are round, and look at the size. All right. And they are 4, so they are both equal bilaterally. I'm now going to do a couple tests with my light. So if you could just look straight ahead for me. All right, and your pupils react to light equal bilaterally. I'm now going to put my my hand in between your eyes. You look straight forward for me, please. All right, and they react consensually, and I'm now going to move my finger in and then move it out, and I just want you to follow it. All right, and they accommodate accordingly, and they are both equally bilateral, or they are both equal bilaterally. I'm now going to look at your ears, and I'm going to look here. Sorry. And the shape is equal bilaterally. The color is uniform and consistent with the rest of your body. I am noting no drainage, and I also see that you have your ears pierced. I'm also going to look at your nose, if you could look up for me. All right, and the nose, your nasal flares are equal bilaterally, and the septum is in midline. There's no deviated septum. I'm going to now have you open up your mouth. All right, you can smile big for me. All right, perfect. And I noticed that your tonsils are not present, so it is graded as a 0. Your teeth are all present, and your gums, tongue, and mucous membranes are all pink and they are moist. The skin on your face is all, I'm noting that there's a couple lesions if you had acne.
Mm-hmm.
All right, so I'm noting also that the skin is uniform in color and the texture is even, and the skin is consistent with the rest of the body and is all intact. I'm now going to move on to that completes, oh, no, it does not complete my head assessment. I'm now going to grade your pulses from your carotids. So I'm going to do that each side one at a time. All right. All right, and I would grade them both out of 2. They're equal bilaterally and they're regular rate and rhythm. I'm now going to palpate your lymph nodes. So I'm going to start underneath your chin and work my way down to your neck. All right. No nodules are noted, and they are small and palpable, or non-palpable, so that is normal. I'm now going to move on to your thoracic area, and I'm going to ask you a couple questions. Are you experiencing any shortness of breath?
No.
Any chest pains?
No.
Any difficulty breathing?
Mm-mm.
Any sensations like your heart is racing?
No.
Are you having any coughing with sputum or any sputum?
Mm-mm.
Any wheezing or snoring?
Nope.
All right, so I am going to just assess your skin and musculature first. Your skin is intact and the color is uniform with the rest of your body. Your shoulders are leveled as well as your clavicle, and they are both equally bilaterally. You appear to have a 2-to-1 ratio for posterior and anterior, and your musculature is even and equal bilaterally. I'm now going to check for skin turgor, so I'm just going to pinch right underneath your clavicles. All right. And there's no tenting noted. So I'm going to now auscultate for Erb's point, and I will listen to your heart rate for 1 minute. I'm going to listen at your third intercostal space, left of the sternal border. All right. Heart rate is 63, and it is regular rate and rhythm, and there's no murmur noted. I am now going to listen to your lung sounds. I should have kept this on. All right, and whenever I touch my stethoscope to your chest, I just want you to breathe in deep for me, please, and big breath out. All right, in. Okay. All right, and I go here. Deep breath. Deep breath for me, please. and breath sounds are clear and there are no adventitious lung sounds noted. I am now going to listen to the back now. Just gonna move your braids. All right, and same thing when I touch my stethoscope, just give a big breath in for me, please. All right. Deep breath. Deep breath. All right, and deep breath. And one more deep breath. All right, and again, breath sounds are clear and there's no adventitious lung sounds present, and they're equal bilaterally. I'm now going to assess the abdomen and ask you a couple questions. Have you had any changes in urination?
No.
Or appetite?
No.
When was your last bowel movement?
This morning.
This morning. And are you experiencing any pain?
No.
All right. So I'm noting that the skin color is uniform and consistent with the rest of the body. The texture appears smooth. I'm noting no redness or edema. And I also noted no redness or edema in your on your chest as well. So I'm going to listen to your bowel sounds now, and I'm going to listen in all 4 quadrants. I'm going to start in your right lower quadrant. All right, and bowel sounds are normal active. I am now going to palpate in all 4 quadrants to check for any nodules or masses. Okay, and there are no nodules or masses noted. I'm now going to assess your upper extremities. Before I do that, are you experiencing any changes in sensation, like any numbness or tingling?
No.
Any weakness?
Mm-mm.
Any changes to your range of motion?
No.
And any pain?
No.
No? Okay. So I'm going to start by just kind of palpating. I'm going to work my way down from your shoulders down to your hands. All right, and I am noting that there is firmness, no hardness or bulging, so that's good. The skin is intact and it is uniform in color and consistent with the rest of your body. I'm now going to have you squeeze my fingers. All right, now if you could pull them. All right, and I'll push on my hands. All right, so muscle strength is a 5 and it is equal bilaterally. I'm going to now check for capillary refill in your fingers. All right. And capillary refill is less than 3 seconds. I'm now going to check your brachial pulses and your radial pulses in both arms. All right. Brachial pulses are graded out of 2 and they're regular in rate and rhythm. I'm now going to check your radial pulses. And radial pulses as well are graded at a 2, and they are equal in rate and rhythm bilaterally. I'm noting no redness or edema, and I will now move on to the lower extremities. Before I assess the lower extremities, I'm going to ask, are you experiencing any pain?
No.
Any changes in sensation, numbness, or tingling?
Mm-mm.
Any weakness?
No.
Any changes in range of motion?
No.
No? Alright. And I'm going to palpate your legs again. So if you could uncross your legs for me, please. Sorry. Alright. Alright, and I'm noting no edema or redness. I also am noting that there is firmness in muscle. However, there's no hardness or bulging, which is good. The skin on your legs is intact. It is uniform in color. It is consistent with the rest of your body. I'm noting no lesions, and I am going to check your posterior tibialis pulses and then your pedal pulses as well. Alright, and pulses are graded at a 2, and they're equal bilaterally, and they're regular in rate and rhythm. I'm going to check your pedal pulse now on both legs, or both hip feet. Alright, and pedal pulses are graded at a 2 as well, and they're regular in rate and rhythm, and they're equal bilaterally. I'm now going to check for your capillary refill in your toes. I'm doing one at a time. Alright, and capillary refill is less than 3 seconds. I'm now going to check, I'm just going to have you push and then like flex against my hands. So if you could push against me. Alright, and now flex. Alright, and muscle strength is graded at a 5 and equal bilaterally. So this completes my head to toe assessment. I'm going to put up the guardrail or the rail for safety, and I'm going to put the call bell here. If you need anything, let me know. Upon assessment, the skin is all intact and uniform in color. There are no abnormalities in the musculoskeletal system or the neuro system, no numbness or tingling noted.